The Mindful Medic podcast is proudly sponsored by the Medical Benevolent Association of New South Wales, ACT. The MBA is an independent charity that has been supporting doctors in New South Wales and the ACT since 1896. They provide specialised counselling, information, referral and financial assistance to doctors and their families during times of adversity or hardship. Their aim is to provide non-judgmental support so that the doctor or family member recovers their well-being and independence and, wherever possible, returns to their vocation. Their services are free, specialised and no referral is necessary. All contact is kept strictly confidential and they are independent of any regulatory body. Welcome back to the Mindful Medic podcast. I'm your host, Cheryl Martin. This is a space where we explore different aspects of health, well-being, performance through the lens of experts not only in healthcare but other disciplines. That said, if you've been listening for some time, you will know I have a particular interest and investment in the well-being, optimal performance and longevity of practice of my fellow clinicians. And we have visited this now in countless episodes, looking at different aspects of well-being and what it means in healthcare and to clinicians. We have looked at systems and, the efficiency and complexity of our practice. We've looked at culture and team dynamics. And we've also looked to the individual tools that we might seek to cultivate, like self-compassion and mindfulness. And I'm conscious this season of the podcast has very much focused on leadership. And I have personally looked to the leadership of others working in this area for several years now. And, to that end, I was fortunate to be able to attend the Stanford WellMD Chief Wellness Officer course in California last month, and to actually meet in person and learn from clinicians whose work I have been studying now for several years. I think I mentioned and have mentioned Dr Joanna on this podcast several times now and quoted much of his work. It was really quite special to meet the clinician in person and to be able to actually learn up close. I will say I feel fortunate to have been able to attend that, but I will caveat that by saying that that opportunity came at significant cost, personally in terms of finances, time, energy, and commitment. And, I'm very pleased to say that that was thoroughly worthwhile. And it's impressive to see the framework, the roadmap, the evidence base and the toolkits available to clinicians working there. And I will say, coming back, we are quite a bit away from that, I'm conscious, over here in Australia and New Zealand, but there is momentum. And today, I'm really delighted to speak to one of the clinicians leading the charge here in terms of organisational wellbeing leadership. So I can't think of a better person to have this conversation with. I really feel that it is an essential conversation because fundamentally clinician wellbeing and the overall pulse or well-being of an organisation in healthcare is inextricably linked to the quality and safety of patient care. Before we get into it, I just wanted to leave you with a couple of definitions of well-being. I think that I've asked so many people and had opportunity to ask people this over the past few years of the podcast. And, I'd love to hear from people listening what wellness and well-being means to them. And it might be different at work and at play. Certainly, Tate Shanafelt describes it as well-being goes beyond the absence of distress and includes being challenged, thriving, and achieving success in various aspects of personal and professional life. I also like Lemaire and Wallace's definition. Well-being reflects the extent to which an individual finds meaning and is authentically able to express themselves in their life and work, which is indicated by an overall satisfaction and balance in one's life. So I'll leave you with those thoughts and ask you to consider your own stance, and we'll get into today's episode.
Yeah, it's a tricky question, isn't it? I think well-being has become quite an abused word. And I feel like we need to do a bit of work to kind of reclaim a decent meaning for it. I come back to, I like the work that Sheree Johnson does in her book talking about flourishing. And I think that's really, what I see as the kind of aim for everyone is to, in the workspace at least, to feel like you want to be there, that you want to be part of improving the place and the systems, that you have the time and space and energy to connect meaningfully with your colleagues and to connect with your patients, that kind of sense of fulfillment and meaning and purpose, to our work. And I feel like we've lost a lot of that along the way.
You've just heard from my wonderful guest today, Dr Joanna Sinclair, who I'm really delighted to welcome to the podcast. Jo is an anaesthetist with a career-long interest in doctors' health and well-being, and we'll get into the specifics of that in this conversation. Critically, since 2020, she has been the Senior Medical Officer Wellbeing Lead at a forward-thinking and innovative trust, Counties Manukau Health, working with the Organisational Development Team. And she's the hospital lead for the Health Roundtable Workforce Wellbeing Improvement Group. She works to improve the well-being of healthcare workers at the organisational level and has been instrumental in bringing Schwartz Rounds to her organisation to further support staff and promote compassion in healthcare. Jo has also undertaken additional training in coaching and mentoring, critical incident stress management and communication. She's also co-chair of the ANZCA Wellbeing Special Interest Group. I personally found Jo to be a tremendous source of knowledge, expertise, support and encouragement in my own work. And I thoroughly enjoyed this conversation. So without further ado, let's get into it. Hi, Jo. Thanks again for making time to join me today on the podcast. I've just been saying that I really can't think of a better person to be having this conversation with at this point, just, fresh from Stanford. And, you're someone who I have followed and who has taught me a lot in the past couple of years and who I really look to as leading the way for us on this side of the world. So you are a staff specialist anaesthetist, and you do have a dedicated, now I know it's essentially a chief wellness officer role. I know you have slightly different terminology, which we'll get into, and responsibility for physician and staff wellbeing for your organisation. Before we get into the specifics of that role, which I really want to explore today, I'd love to hear a bit about your career journey to date as an anaesthetist, and I suppose your wife, your specialty, but particularly at which point and clinician wellbeing became something important and a focus for you, and what has transpired to be a professional mission today.
Yeah, sure. Thanks, Cheryl. It's real privilege to be here and very humbling to hear you describe me in those terms. I don't have any great stories behind being an anaesthetist, really. It was kind of a process of elimination of a few different areas that I was interested in. But once I found anaesthetics, it kind of felt like home and gelled for me. The biggest thing I can remember is having been thinking, oh, maybe I'll find something that doesn't need big specialist exams to do, to find a specialty where I could sort of stomach the idea of doing the specialist exams. I thought was a key factor in me realising that this was something that might work for me. But in terms of, my interest in initially just wellbeing of anaesthetists started really early on. We get exposed to the stats around high rates of substance abuse and suicide in our profession. And I guess from an early stage, it struck me that was really unfair, I think is the word I keep coming back to, because, you're aware of this long journey that you've been in, how much of yourself you've given to, a career in medicine, the time at med school, and then all the training time that goes into it. And you're also aware of, what sort of headspace you're in when you start out in healthcare, that you want to help people and it's all very altruistic and positive and all the nice things. And then sort of thinking, how do we get to this place where we're so unhappy and, it's supposed to be a caring profession, and what are we doing to these people within that profession that they end up in these places where they're, hooked on substances, or they want to take their own lives, or they're thinking about it at least. And so I became really interested in what was behind all of that. I guess a little bit of, how do I stop myself from becoming one of those people? And how do we change that? How do we stop that from happening to people? So I started with an interest within anaesthetics, and we've always had a special interest group for wellbeing within the college. And so, there's always been sessions at our conferences and things like that are dedicated to wellbeing, which has really until recently been a lot about awareness raising rather than an action side of things. But so a lot of opportunities to become more aware of what the issues were and learn from people that had been thinking about it for a while. And there've been a few kind of key people in that space, I suppose, that have been mentors in that respect, that have been, researching substance abuse and anaesthetists and what's behind it and what's involved. And so learning from them, I can remember approaching one of them really early on and kind of saying, you're a real specialist in this area, the go-to person at your hospital. How do I learn how do I collect all the wisdom that you've developed over the years to do something similar where I am? And he said it's all self-directed learning.
At what point in your career was this?
This was when I was still a registrar. Yeah. So probably an advanced trainee stage from memory was when I had something to do with him. So I was kind of thinking, there must be some courses we can go on or some stuff we can learn. And he said, that's all, I've just been interested and just learned along the way. So that set the scene for me very early on. I think that was, a lot of what this was about. Although that has changed now, as you know, there are, lots of courses addressing parts of what we kind of try and do in the wellbeing space that can, things like coaching courses now, people do a lot more work on mentoring in a more structured way, communication courses, the course that you've just been on, the Chief Wellness Officer course, that those things didn't exist not that long ago. And so now there are a lot more things that you can do, a lot more amazing books out there to learn from experts in the field.
Oh, there's quite a few things that I want to pick up on, just frantically scribbling. So the first thing I find it really interesting that you very early on were aware that wellbeing conversations were being had early on in your training. Certainly from my perspective, I think I remember just becoming a fellow and then day 3 of our conference was suddenly all wellbeing, and this was quite a new thing. But then I also, a bit of a reflection thinking that, it was my anaesthetic colleagues that were light years ahead in terms of training for simulation, halo events, that I'm safe, more of an aviation approach to safety and quality. And we've had a big discussion this week about the safety and quality movement and where that has come over 2 decades, and the fact that, potentially that, well, you'd like to see that's where the wellbeing movement will come with that approach. So you identified a mentor, there was people working in this space, got the message of self-directed learning. So where did you go next? And were you the only person at that point really kind of thinking about championing this? How did it develop?
So the guy that I approached, Rob Fry, is an anaesthetist at Auckland Hospital and has always been very active in the kind of wellbeing space. So he was in my area that I was working in. I didn't feel like I was going to be, breaking ground or anything like that at that stage. It was really just wanting to be a wellbeing advocate in my own hospital, in my own department, and do some work in that space. And then I got a job at Middlemore Hospital initially as a fellow and then as a consultant, and we had a head of department at the time who was also very interested in wellbeing, very people orientated, and so she was a great sort of mentor in terms of encouraging me to pursue that side of things and giving me some space to do that. And so that was when I started sort of looking into, I guess, equipping myself with more tools to have difficult conversations with people, trying to fill gaps that I could see. So I did, a mentoring course, and I did a communication course, and just tried to kind of, psychological first aid, those kind of things, just to try and basically my approach was, if I came across something that made me feel uncomfortable or nervous to deal with, then I'd look for something that could fill in some blanks and also gaps in my knowledge so that I would feel more comfortable with that. So it was kind of trial and error, I suppose, in trying to figure out what I needed.
And you've said some space there. What did that look like? Because I think, my impression, and correct me if I'm wrong, was a lot of this work you were doing in your own time, self-directed, voluntarily. Did you get any dedicated FTE or clinical time to actually devote to some of this work at that stage?
No, it's as you said, it was what I used, any non-clinical time that I got, and what I did in my with my CME time and money. So we've always had a much, I think Australia's got a lot more now than they used to have, but we've had a lot more generous allowance for a long time. So I was able to use that to, I've been to a couple of the international conferences on physician health, and various other kind of wellbeing related conferences.
So you've identified that this is something that is important to you, and you are going to, dedicate your non-clinical time, and I suspect a significant amount of time outside that, to learning more and developing a skill set. I'm curious to know what the early reception was from your colleagues.
I've always felt like it's been quite well received. They do, looking back, think of it as in that early time being very much just about awareness raising. It didn't feel like there was much in the way of action or much of an appetite for anything too kind of challenging in the wellbeing space. And I've certainly had subsequent, leaders within our department where it's been a lot harder to try and implement any actions. Things that, for example, for a long time it felt really difficult to try and do any kind of survey work within my department in terms of wellbeing stuff. And I had a sense that, or it was not just a sense, it was described in quite concrete terms that, you don't want to open up any cans of worms or, rock the boat or anything like that by, proving that we have poor morale or anything along those lines. So, yeah. So I guess for a while it felt like the action side of things was harder. They were people have always been really grateful to think that there's someone that's kind of looking out for that side of things and trying to do some work. But going those sort of few steps further and really kind of challenging people to do some work themselves is kind of often where I find that's where you start to sort of hit up against walls.
Yeah. I want to really go into, how you've actually made this a dedicated leadership role. But before I do that, can I ask a question I normally ask at the end? Because it's something that, I probably should be asking this up front. And particularly, I think with you, it's important to kind of to start there. What is wellness, well-being? What does it mean for you? And what does it mean at work, do you think? What is your kind of working definition for that and for your colleagues and for your workplace?
Yeah, it's a tricky question, isn't it? I think well-being has become quite an abused word. And I feel like we need to do a bit of work to kind of reclaim a decent meaning for it. I come back to, I like the work that Sheree Johnson does in her book talking about flourishing. And I think that's really, what I see as the kind of aim for everyone is to, in the workspace at least, to feel like you want to be there, that you want to be part of improving the place and the systems, that you have the time and space and energy to connect meaningfully with your colleagues and to connect with your patients, that kind of sense of fulfillment and meaning and purpose, to our work. And I feel like we've lost a lot of that along the way.
Yeah, nice. I think we were floating a couple of definitions of well-being last week, but I really like Tate Shanafelt's, that holistic view of professional fulfillment. I keep coming back to that. And just on that, at this point, were you aware of any of the work they were doing overseas, actually getting some data, doing some research around this and developing a roadmap?
Yeah, that's a good question. I can't think of. So Tate Shanafelt spoke at the conference on physician health that I went to in Montreal, which must be quite a long time ago, and I cannot think what year that was, but it's going to be a while ago now. And I think I was loosely aware of him before that. And he spoke as well as he always does at that conference. And so then I became aware of the work that they were doing at the Mayo Clinic with the Wellbeing Index, and all the kind of, he's been an author that I keep my eye out for on papers and things like that. So a long time. I used the Wellbeing Index at my organisation in 2018, and I must have been, aware of it well before then. I think a lot of their work came out in sort of 2016.
Yeah, I've watched your walk through the Wellbeing Index tool quite a few times now. I think it's fantastic, and I've directed quite a few colleagues to it. So for people listening that maybe aren't familiar with the tool, do you mind explaining, what it is and, specifically what attracted you to it as a way to gather some data and information around this?
Yeah, sure. So it's a very simple tool, which is what drew me to it. So it uses 7 yes/no questions and 2 Likert scale questions to look at your well-being and burnout and distress, and creates this wellbeing index score based on what your answers are. And then that correlates with your likelihood of fatigue, poor quality of life, burnout, suicidal thoughts. And it's been the things that drew me to, there's a number of things that drew me to it. One is that it is short and sweet. So, I think I felt like it had a chance of getting reasonable buy-in because people didn't have to spend a long time on it. But by the same token, it's been validated against those longer survey tools that are out there, the longer sort of burnout inventories and things like that. There's lots of publications out there showing how they did their validation studies against those tools and that it stacked up really well. It's been validated in a range of different populations, and so they then have these licenses that apply to there's a different one for physicians, a different one for nurses, because they found that the score that correlates to high levels of distress is different for each of those groups. So I liked that about it as well, that it's not just a kind of one-size-fits-all thing, that there is that kind of recognition that we're not all just one amorphous kind of group of people within healthcare.
I want to talk about that.
Yeah. And it's sort of, I guess it's out there, it's published, the information about it is out there and published and freely available. And they do, whilst it's now run under license, there are ways to get hold of it for research purposes or that kind of thing that don't cost money. So they have tried to make it accessible to people as well. And then of course, as you know, it's become available through the Health Roundtable, and so you can access the licenses as an organisation for a lot less than if you just approached the licence holders in the States for it as well. And that comes with a whole stack of additional support and when I did it myself for my department back in 2018 using a SurveyMonkey and setting up myself and crunching endless amounts of data. That was, took a lot of time, but now I can push a few buttons and get a report through the Health Roundtable.
So you did all of that before you had the Wellbeing Index.
Yeah.
Tell me about that early, because that is a lot of work.
How did
that look like then?
So my department was not what it used to be. So when I joined, it was I felt like it was an amazing collegial place with great morale, fantastic leadership and what have you. And then we had sort of some changes in leadership and changes in other bits and pieces. And I really felt like morale was kind of going downhill. And whilst I was in this kind of wellbeing advocacy role, it felt like an unstoppable kind of thing. But it also felt like it was being ignored a bit. There's a lot of, head in the sand kind of stuff from leadership. And I had floated the idea of surveying and kind of being shut down. And then we got to this point, without going into a long story, but it was just looked like a really good opportunity that maybe this would be my chance to get some traction. Yeah. We had a meeting with hospital leadership coming up. So I said, what about if I do this survey before we do this, and then we can really show them what it's like to be in our department? And they said, yeah, sure, go for it. So I put together a SurveyMonkey and did that for my anaesthetic department. And because of where we were at the time, I've got a department of, I think at that stage there was 70 maybe anaesthetists in my department, and we had a 95% response rate because everyone was, fired up and wanted to tell everyone what it was like. So, yeah. And so we had this meeting with the hospital leadership where they said, one of my colleagues, it just got set up so beautifully. One of my colleagues said, so why are you here? Like, why have you come to talk to us? Like, what do you actually want to know? And the guy said, I want to know what it's like to be an anaesthetist at Counties Manukau Health. And I'm like, right, let me tell you, because we had massively high rates of distress and burnout, and it shocked them all. And it quickly got a lot of attention from
and led to conversations.
The managers, and led to conversations. And, our service manager said, well, when we have the meetings of all the service managers, I'm pretty sure, particularly those people in general medicine, they're in real trouble. I bet they'd be interested to know about this. And so very quickly it kind of grew to maybe you could survey the whole SMO group. So I did that. And really, I was already kind of starting to look out of our department in terms of recognising that this wasn't just an anaesthetist's problem. This was an everyone problem, every doctor problem, and then actually it's not just doctors either. So I, once I had the data from the whole of the hospital SMO group, the senior medical officer group, saying that this was a widespread problem, it kind of snowballed from there. So I put in a proposal to hospital leadership to say, this is a widespread problem. When I look around what's being done in the hospital, I see stuff that's aimed at, nursing staff. It's done at times that clinical staff can't get to. It's not. There was a report for like an annual report for the hospital, and there was a section on employee wellbeing. There's no mention anywhere in there of doctors. It was all everyone else in the hospital. And it's kind of like we've got this group of people that are so burnt out and so distressed, and there's nothing happening that reaches them or includes them in as a voice to kind of figure out what the problems are. And yet that senior medical workforce is the part of our workforce that stays. They're the group that tend to join up to a hospital for their careers, and they stay there in clinical medicine. Don't tend to be a high turnover group. So that's the group we should be engaging and getting involved with, making changes to improve things in our hospitals. So I put in a proposal for essentially like a chief wellness officer role to give an SMO voice.
For people listening, this is, you're just playing all of this down, but really this is trailblazing. And at this point on this side of the world, this was new. You were somebody leading the way. And you've said, I put in a proposal, but that was a full business case that you have put a lot of time and thought, and this was a culmination of, several years of work up to that. I want to acknowledge that, because it's, it's inspiring for, I think, other people following in your wake. I want, that proposal, tell me about the process of doing that, because yes, you've got momentum, you've got traction, finally, you've got to take your opportunity. But how did you actually start then going about that? Because I think that unless you've maybe done some work in business administration, and you become a consultant, and then suddenly a business case, where do you start? And particularly for this, I think even more, because this is something people think, it's wellness, it's not tangible. How do you actually build? You talk about building the pieces of substance around it.
Yeah, absolutely. I had zero clue about what a business case was or looked like, and to be fair, what I put in wasn't strictly a business case. I started off, Tatiana Feltz published this great article that tells you how to put together a business case for wellbeing, investment in wellbeing. So I definitely had that in front of me. But he's laid out like a formula that you use to show what the return on investment would be. And so I did start with that, and I went to our HR people and was kind of like, so can I get this information? Can I get information about turnover of staff? No, not really. We don't really have that kind of information. Have we got sick leave information? We've got some for the nurses, but I don't think we've really got any for doctors. I just kept, that in itself was like, how are we not measuring these things? Yeah. Like, how are we not measuring EAP contacts or turnover, sick days, people dropping their FTE, so there was nothing like that. So then I'm sort of looking at this going, I can't create a business case like that because I don't have information to use. So I really just used what was out there in terms of, the studies that had been done in the States saying, and there were some from other places as well. I can't off the top of my head think of it, but there's a few articles out there that talk about, that give a figure for return on investment and wellbeing. So I just included, what's out there in the literature and all the work that Tate had done and others, of course, and my data and kind of an argument for why I thought this was what we needed. So it was more of that. I included as much as I could in terms of data and figures and what have you, but there was a lot of this is a huge problem. This is the right thing to do.
Yeah, and look, we've spoken about the financial aspects of this business case, which is what we traditionally think of when we think of a business case, the idea of return of investment. But the as you've also alluded to, the reality is this has moral and ethical considerations. All the other kind of dimensions of what this proposal has in putting together. And I think the other key thing is you had local data. And I know you've contributed, and again, I will link it to the white paper that Health Roundtable and Beamtree produced last year, as Sarah Dalton's been on the podcast. And, this, what I keep coming back to, this need for local data-driven, evidence-based solutions. And here you are actually starting to simulate your own local relevant data to my organisation. This is our people. We can grow from here because we can make this our own.
Yeah, for sure. I mean, that is the most meaningful part of it. You can't ignore, you can write off everything else, well, that's American data, that's not us, we're a different context or what have you. But if you've got some figures in front of you, and I mean, for that one in particular, when you've got, 90% of the anaesthetics department responding. And then when I did it for all SMOs, it was something like 60%, which is still pretty amazing for a survey, 60% response rate. So it couldn't be ignored. Sadly, subsequently, with the Wellbeing Index, we don't get anywhere near those response rates. So I went in with great, I'm going to get all this data, but, we don't get as much, but it's still keeping an eye on it and there's something there that you can use to keep it in the minds of the hospital,
So you have this proposal and you don't have the Wellbeing Index at that point. So what was the initial reception to that and what has transpired since? Because I know there's quite a bit.
So the reception was actually really positive, which was great. So I spoke to the Chief Medical Officer initially, and she very quickly pulled in the Director of Human Resources. And so I met with them a few times and they were very supportive right from the outset. So, I can't complain in any way there. And basically, I think I did also meet with the CEO at that point as well, and she was very supportive. And so at that point, the HR director said, look, I'll take your proposal and I'll craft it into the right format for the executive leadership team and we'll get this through. And then that took 18 months. So, and that was a long 18 months in that, I wanted to start doing things. I wanted things to happen. But I was also kind of aware that, as you say, it's totally new, trailblazing kind of stuff, and I felt this responsibility to try and make it happen. Mm-hmm. And part of trying to make it happen was to be a bit patient and to not derail the thing by being pushy and aggressive. So I did spend long tracts of time sort of sitting on my hands and waiting and feeling frustrated, but not wanting to kind of blow up at people about it. And just, I'd sort of bide my time for as long as I could and then go and check in again. And every time I'd check in, they'd be like, no, absolutely, this is going to happen, I'm thinking about an office space for you. I'm like, can we just make it happen before we think about office spaces?
I think the other important thing you said to me is also to know you are the expert in this area and know that value and worth, and not, to actually withhold some of your time because you're already doing a lot in your own time. Yeah, that's a good point as well. That was the other part of it, was because you want to get on and make things happen and try and change what you see in front of you. It is very tempting to say, they're not going to give me this time or money. I just need to keep going. But I was wary of, if I was to just keep giving my time and effort for free, why would they have any need to create, a funded role for this work?
I felt it was really important to advocate for proper investment in trying to reduce, distress and burnout in our healthcare workforce. And if all we do is keep putting in that discretionary effort in our own time, using our own money, and this felt like an opportunity to kind of tip the scale a little bit. So that sitting on my hands was also about not jumping in and just doing stuff anyway.
And I'm sure you were still doing quite a lot of that.
Yeah. Also doing nothing for sure. But yeah.
So getting this, once the role is established, they talk about, we know that initiatives work, and we know that a lot of the stuff that we still focus on is very much focused on individuals, and they definitely have merit, a lot of the tools, but we also know that healthcare workers, and we've had this conversation many times on this podcast, they already have resilience in spades. We've talked about physicians and different craft groups potentially having different needs too. And a big lesson that I am being taught is the importance of having, an overarching strategy and not just a whole bunch of tactics. And to quite clearly know, because you can't be all things to all people, and that's the real risk with this. What is your scope? Where are you going to focus? So how did you start with, minimal? You still don't have an army of people around you, and I know that that's still the case. How did you navigate that in your first steps in the role?
Yeah, it was. That's definitely been a challenge, and I still feel like I've achieved a lot since I've been in the role, but I also feel like it's not quite what I hoped it would be in terms of that more kind of overarching organizational level stuff. But there was a lot of serendipity in that by the time this role came into being, it was March 2020, and I was kind of starting, and we had a sort of very loose job description for what the role was going to be. It coincided with the Health Roundtable signing up to the Wellbeing Index, and so we were able to get buy-in with that very quickly, just for that the senior doctors, because our HR director kind of said, well, let's do that. That gives you something to kind of get started within the role. And then, of course, COVID arrived, and that totally changed the landscape, and things got very busy very quickly. I got pulled into all sorts of different working groups, trying to pull together wellbeing stuff to support staff. And it also made it a little bit easier to get stuff done a lot more quickly than I was ever expecting it would happen. So I think I was, I benefited from that in a lot of ways. And so in that first kind of year, I felt like we got more stuff in than I ever would have hoped to have done. So, for example, one of my big goals was to try and coordinate the wellbeing stuff that was going on across the hospital a lot better. Like, it was really hard to find what was going on around the hospital. It was all in little bits and pieces. There was lots of work going on in silos, and to try and kind of connect all the dots across the organisation, reduce repetition, have a bit more collaboration. And of course, with COVID, that's immediately all the work that they got into, was trying to, right, who's doing what, and let's pull it all together and get it all coordinated.
I think that's a really important point, because there are a lot of people doing, great things, as you say, in silos, and actually being able to harness the pockets of excellence and use that suddenly gives you more scope to actually do a lot more.
Yeah, definitely. And there was so much stuff, and people not talking to each other about what they were doing, and that also, if you're not kind of advertising to staff very well what's available, you might as well not be doing it, because they go, our hospital does nothing about X, Y, and Z. Or sometimes they actually are, but if they don't tell you about it, then they might as well not be, because the staff still feel like that stuff's not being done.
And what was your approach to that, to actually, because I this is something that I'm grappling with all the time in terms of how you actually get information to the right people at the right time when they're overloaded? And I know potentially you had a more receptive audience through COVID, but what challenges have you faced in that respect? And I suppose what opportunities what have you seen work?
Yeah, it is really challenging because we're still going through stages where people are so, their inboxes are totally overwhelmed with email messages. We have a hospital bulletin that goes out 3 times a week, but I don't think hardly any doctors look at it when it comes around.
Similar experience.
Yeah, so there's all sorts of channels out there. There's, then they're running webinars 3 lunchtimes a week, and but in our theatre environment, we're not stopping anything at lunchtime to be able to go and listen to webinars or anything like that, for example. So it is really challenging, and I don't think I've found a real solution for that. One of the things was that kind of if people did sort of say, oh, do we do anything about whatever, your go-to would be the intranet for the hospital, right, to try and find things. And a lot of things were really buried in there. So we've eventually been able to get kind of a centralised hub for that's better organised, so you can find, the Schwartz Rounds information in there just with one click kind of thing, rather than hunting through pages and not being able to find things. But yeah, I mean, and there's also, there's other barriers, like there's groups of people in the hospital, like, some of our orderlies and cleaning staff that don't have the hospital email system, for example, at all, and they don't go on the intranet, and some of them don't have smartphones. And so you have to sort of also think about specifically reaching out to certain groups, going back to print medium, various things like that, rather than expecting people to go looking for things when they need them. So I guess it's about sort of trying to cover a whole bunch of different routes of communicating with people, and thinking about how people receive information, rather than just what are my avenues for getting information out there. And being creative, trying to think of new ideas. But like as I said, we've not found, the ultimate solution.
Yeah, and just I'd like to just develop this idea of the communication across the organisation. Certainly, it's important to get information to the right people, and that is a challenge. But also getting information from people in terms of what is relevant and important to them. They talk about ask, listen, empower. Listening tours, focus groups, all of these things in addition to survey work. For example, myself as an emergency physician, you as an anaesthetist, we have some idea within our craft group of, the pressure points, the sticking points, the pebbles in the shoes. But suddenly you have this wider scope and remit. And, we've already said that even within, the group of physicians, different craft groups will have different needs. And then again, if you go outside, different disciplines within the organisation, nursing staff, allied health, will have different needs. So I wonder, have you done any work around, listening tours? And again, what is the result of that? What has worked? What are the challenges?
Yeah, so I have it's been challenging through, on and off lockdowns and things like that, but I have contacted all the SMOs and said, if I can get along to your departmental meetings, just to sort of let you know what I'm up to, and I'd really like to hear about what the issues are within your area. And so I've only probably had half a dozen of those meetings, because, you get on a bit of a roll and then another lockdown comes, or, flu season arrives and they stop doing them or whatever. But I have been able to, go to them, and they've been really helpful, and people have always wanted to really, offload all the stuff that's going on. And it's been particularly useful in the world of medicine, because I feel like I have more of a grasp on the surgical services side of things. but to be able to talk to the doctors who run clinics, which is not my world, and do spend a lot more time on the ward seeing patients and things. So just to get them to kind of, I just say to them, I'd just like to hear about, what it's like in your world and what the challenges are and what are the things that you're, finding particularly frustrating that you're not getting any traction with, that I might be able to, advocate for you at a, different table that I have a seat at that you don't get to sit at or what have you. And just really, listening and collecting information. There's only been one of those where it was a real rant at me.
Yeah, but that is the real risk with this, that you become the complaints department.
Yeah, exactly. Yeah, and I've found so far, people have been really understanding about that. Like, they might sort of let fly when once they get in the swing of things, they're just kind of going off about everything that's upsetting them, which is fine. And then, but they've always, at the end of it, gone, thank you for listening. We don't expect you to fix all of this, but it's just nice to know that somebody's listened, which is almost, sometimes I find it a little bit sad almost, because it's kind of like, well, that's the really simple part. Listening is easy. And if that's all that you needed, how has nobody thought to do that, already?
Yeah, but I think that's a really powerful point. And, we aren't listening enough, particularly listening to understand.
Yeah. But I always feel like, they deserve to have an expectation that somebody might actually do something about it. And yet they just, I've had my rant, I feel better now, thanks. I'll just go back to this job that's frustrating the hell out of me.
So, again, starting to think about those bigger kind of system issues, efficiency of our practice, all the things that, the pebbles in the shoes, but also the cultural considerations. And I know that's where the kind of role of the CWO is to look at all of that in space, and probably those big ticket items are the other two dimensions of, I really like that Stanford model. What are your big wins? I know Schwartz Rounds might be in there in terms of your big things that you championed.
Yeah. So, I think all of the stuff that I've done, I think if I was to group it all together in the last 2 years, I think has been around trying to restore some of the connections around the hospital and giving people a forum to share their stories. And it feels like that's all about the culture of the place, really. And when I think about it like that, then it feels like it is a good fit for a CWO role. But when I see them in individual, I sometimes think, is it just another wellness initiative? And it's not actually doing anything. But, I think Schwartz Rounds is probably the thing that I'm the most proud of, because it is really that opportunity to connect with other parts of the hospital that you don't normally have any exposure to, and to just really humanize all our people. And there's been a lot of powerful feedback from students that have been in the room listening to consultants be really vulnerable about how stressful things have been, and they've given us feedback about how impactful that was, and just even being able to see my colleagues that I know as these very professional, competent surgeons, for example, who are of course no less professional and competent for being vulnerable, but you don't see that side of them in the professional situation, and to see that they are so willing to show up to a Schwartz round and share that side of them is quite a privilege to be in the room when that sort of stuff goes on.
For anyone listening who's not familiar with Schwartz Rounds, do you mind giving a bit of an overview of what they're about, what their purpose is? Because I suspect if your organisation is not evolved, and it's a bit like a club, that you probably haven't heard much about them.
Yes, yeah. Yeah, so that they were, there's an organisation in the States called the Schwartz Centre for Compassion in Healthcare, and there was a man called Ken Schwartz, who was a healthcare lawyer who unfortunately at a fairly young age and being fairly fit got diagnosed with lung cancer, and over the year from diagnosis to when he died, he reflected on the small acts of kindness from healthcare staff that really made a massive difference to him. And so he left the legacy that enabled the Schwartz Rounds to be set up at the hospital where he worked and where he died. And so it's a confidential space. It's for all staff. That's really important. It's not like a medical grand round that's just all the physicians coming to or all the doctors. It's for absolutely everyone at the organisation to come together, and it's facilitated by a trained facilitator who, at our organisation, it's a psychiatrist or a couple of our health psychologists. And it starts with a panel of sort of 3 or 4 people who speak for just a few minutes each to the sort of social or emotional impact of working in a healthcare organisation based around either a patient or a theme. And the facilitator kind of prepares them for it and then leads them through it. And then it's opened to the audience for people to share their reflections on what's been said or their own stories and what have you. And then it's just kind of, brought together at the end by the facilitator. So it's very different. It's not about problem solving or, we do still get feedback from a lot of people kind of saying, I came to this expecting to get get told how to manage, blah, 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 blah. It's not about that. It's just about, storytelling and shared experience and really connecting with each other and developing a bit more compassion for each other and our patients and ourselves, really, based on what we share. So I love them. I think it's a fantastic forum. I think medicine's kind of built around storytelling as a profession, and so I think it's a natural part of it, but we don't get those opportunities to share our own stories with each other very much.
Oh, we've spoken a few times about the power of stories, and I really like the idea of reclaiming stories for science. Is it L'Oreal Lingard's work?
Oh, yes, yeah.
So, we are very early in our Schwartz Round journey, but it's really encouraging to hear that. And you've also rolled out the stress for first aid, I think.
Yeah, we're just rolling that out now. So that's also come to us through the Schwartz Centre membership. And that's a sort of self-care and peer support model that's been developed for healthcare based on some work of the National Centre for PTSD in the States. But it's the Schwartz Centre basically give you the training, and then you can turn it into a model that fits your organisation, which is what we've done. So we had about 10 of us go through the train-the-trainer kind of learnings, and then we've shaped the resources into something that fits with our context and our, the culture of our staff and that kind of thing. And we did a pilot with ED, and we're rolling it out in a couple of other divisions at the moment, and going well so far. I think there's peer support seems to come up quite a lot in a lot of the wellbeing related conferences and things like that, or when we're talking about what people need. And I think it came out quite a lot in the research, wellbeing research that came out of COVID, that healthcare workers preferentially choose to debrief socially with colleagues rather than going and making an appointment to see a psychologist, or engage with their EAP service or what have you. But, I guess I reflected on, where I started with anaesthetics and being concerned about substance abuse and suicide and things. If you're thinking about your colleagues in those kind of contexts, reaching out to somebody who you think it might be in distress can be quite scary, because you think, well, what if they tell me that they're suicidal? I don't know what to say to someone who's suicidal. Or what if I say the wrong thing and it makes them, go and harm themselves? And so I think things like this that give people some tools, some confidence, give them a bit of education around, the benefits and lack of harm of reaching someone out to somebody who's distressed, can only help make those conversations easier, and that hopefully increase our capacity to support each other.
Yeah, fantastic. Jo, I think you've given this really beautiful overview of not just individual tactics and initiatives that you're using, based on local need, based on data, but also, this overarching leadership role where you're making clinician and staff wellbeing a focus across many of the major organisational decisions. And, this is a leadership role. And this series of the podcast has had a particular focus on leadership. And we also know, harness the power of leadership, that is very important for staff wellbeing itself. We know that measuring leadership and, dedicated leadership development is very important in this respect. And I know that we have, potentially, if you're using the Wellbeing Index, you might have access to the Mayo Clinic leadership index measurement tool. And I wonder if that's something that you have thought about using. Have you done any work around measurement of leadership or dedicated leadership development? Or is that something that you might plan to do in the future?
I definitely, my own experience within our department is watching the impact over the last sort of 12 years that I've been in the department of different leadership styles. Just on our department, I feel like I've had my own little, case study across the years. So I sort of feel like I have that kind of lived experience of seeing how much of an impact a leader can have on their team. So I think it's really, really important. And as I think you sort of said something earlier about, it's not something, we don't get trained in writing business cases. We also don't get trained in leadership as part of our medical training. And so I think there's a huge amount of work that could be done in that area to improve the skills that our doctors bring to leadership roles. And I feel like, I don't know what it's like in other institutions, but my observation at ours is that it seems like sometimes it's like being a head of department is viewed as an end of career thing to do, whereas we have other people that are kind of mid-career that would make amazing leaders and have interest in it, but there's no concept of how you return back to a full-time clinical role after you've been doing a head of department role for 4 years. It's kind of like an exit strategy, but if all you do is leave it to the people that are at the end of their careers, their care factor is not quite so high either in terms of improving the place, because it's not going to be their place when they leave. So I think there's a lot of work to be done.
I was listening to Kevin Poe's podcast the other day, and he had a brilliant medical student on who was concurrently studying for an MBA through her training. And, she was talking about her desire to, start to develop and cultivate her leadership skills and other areas of management and administration, early on. And, she also spoke about the creativity, the innovation that she sees all around her in her peers, wanting to go in to make positive change in the healthcare system for clinicians, for patients. But the podcast finished on quite a jarring note where she made the observation that, she sees all of this innovation around about her and enthusiasm. But, what they are seeing and being told on the other side of qualification is that there is this epidemic of burnout and a need for wellness. And, it made me think of, a particular slide that I saw at Stanford last week, based on some work that they had done there with doctors starting in medical school, looking at, again, their, mental health, positivity, engagement, and seeing, that is above average, which you would expect in medical school. But then seeing this reversal, which kind of reaches a nadir, at peak mid-residency, and continues. And, that is a real concern. I think the next generation give me a lot of hope. But, that's why this work is important.
Yeah, I think there's a lot of work to be done within the culture of medicine as well. I think we do have, there's changes happening in terms of the way we teach our medical students, both in terms of looking after themselves, aspirations, that kind of thing. But if they keep hitting these training schemes where they keep getting those messages around, I had it much worse in my day, you need to toe the line to get on to the training scheme or what have you, it kind of beats all that innovation out of them. And innovation is what we really need to kind of turn things around from where we are. Like, we don't want to keep perpetuating where we are now because we're all burnt out, and that's not what we want for the future of healthcare. So I think that's another
what you are doing.
Big area that needs to change.
I'd love to know what you're currently working on, because you, I know that you've got an upcoming conference that sounds quite exciting with the Anaesthetic College, and also you've been running some physician retreats. Can you tell me a little bit about those?
Yeah, sure. Yes, working on too many things all at once, Cheryl.
That is my final segment of this podcast.
I know. So I have joined with 3 other all emergency physicians who are also really interested in wellbeing, and we ran our first retreat for doctors focused on, well, it's kind of Cherie's book again, The Thriving Doctor. That kind of is what our retreat's all about, really. So it's kind of talking about these issues in our wellbeing that we're facing in healthcare, and a bit of an opportunity for connection, a bit of rest and rejuvenation, and thinking about problem solving as well. And we ran our first one of those in March, and it was so amazing, actually. It was just a real privilege to be in a room with a group of kind of 16 other, they're all women actually, which was, it's not all just for women, but they happened to be, but to be part of a group that were so open and just sharing their experiences and so receptive to what we were doing. It was a real privilege. And so we're continuing with those as well.
I have to give a shout out to our colleagues, Doctors Joe Cole and Joe Egan at this point. I know that they listen to the podcast and that they are collaborating with you. And, have you read the book We Are All Perfectly Fine by Gillian Horton?
No, I haven't read that one.
Yeah, she also wrote a fantastic article called Muffin Rage, which I probably should link in the show notes too. And, her book is about, she's a Canadian physician who now runs her own or is involved in running physician retreats. But the book is about her experience of attending her first one. And, I suspect we're going to see more of this as we progress. Certainly Dr. Amy Imms here in Tasmania, I know, has ran one recently. And I think Dr. Emily Amos in Victoria, similarly. So watch this space.
Yeah, absolutely. And then I'm quite preoccupied at the moment with we've got big health reforms happening in New Zealand, and trying to advocate very strongly for clinician involvement in the kind of people and culture plan. So trying to advocate for a different model where we have a clinician voice in there. So like a chief wellness officer, basically embedded through the system. So something at a real high level, as well as kind of regional and district wellbeing leads. It's kind of looking a little bit like it's just going to be a rebranding of the same system. So there's a whole, all people with a vested interest are kind of all trying to advocate for having clinicians in at those higher levels. So that's kind of a bit of an obsession at the moment. And stress first aid training. And yes, we've got our big annual college conference coming up next year. And then at the end of this year, or later in this year, we've got our combined special interest group meeting, which is being led by the Wellbeing Special Interest Group. And we've got Beth Ann Richards coming, which I'm very excited about, and Jane Munro as well. So and Fiona Fitzgerald from the Health Roundtable. So I think we're going to be able to have some really great sessions talking about that organisational level input into changing the future for our health workforce. So that's
hoping to get
exciting.
some of them on the podcast in the future as well.
Yeah,
I think that will be a wonderful meeting of minds. I'm a bit obsessed with appreciative inquiry, thanks to the Being Better Together podcast, and also having visited it on the Stanford Wellbeing Directors course last year. And so I'd love to know, in the spirit of that, what this work and this role looks like at its best for you in the future. If time and money resources are not limited, what would you do now and in the next 5 to 10 years?
So I would like to, like I said, I do keep wondering whether I'm not doing overly much more than some fancy kind of wellbeing initiatives. I'd really like to be able to get kind of stuck into seeing what we could do at a more of a higher organisational level, to really kind of get stuck into the organisational issues, to look at different ways of doing things, to be able to do some deep dives into what is it that our frontline healthcare workers really want to improve things. I mean, obviously the quick answer is we need more staff, and sadly we don't have staff waiting in the wings to come in. And so aside from that kind of workforce pipeline stuff, which is crucial, I just feel like a lot of the wellbeing kind of outputs from our healthcare organisations are just aimed at helping people to cope with a broken system. And I'd really like to see a lot more being done at a higher level to fix the broken system, rather than just kind of help people cope with it. So more meaningful kind of long-term change within our healthcare system. And I'd like to see our colleges looking for ways that they can advocate for us in that space as well. I know that they don't traditionally see themselves as being intersecting with the kind of employment role that our hospitals have. But I feel like they do have power that's not being used, optimally to support us, to support their fellows within the workplace.
I'm really impressed by the American Medical Association's Pathways Steps Forward program, and
that's good.
On there. And I was speaking to Christine Zinsky on at the course, and I'd love to see Australian and New Zealand medical associations really take some of that work on board. I know there's a lot of resources, but that would be I think it'd be a real value add for the next 5 to 10 years.
Yeah, absolutely. And I think one of the other things that we don't have in New Zealand that I know has been developing in Australia over recent years is doctors' health programs. We don't have, we've got an advisory service that's a phone number you can call, but I'd really like to see much more comprehensive, doctors' health programs or what have you. I
just wanted to say, I think you've said a couple of times that you don't feel that you're doing enough and that this is just fancy wellbeing programs. Can I just say that from an external, a close observer of your work, who I do consider, someone who's inspiring me and a mentor, that you are doing incredible work and you are leading the way for, many other people coming after you, Bethan Richards, Dr. Bethan Richards. So I want to thank you for that.
Thanks.
I'm conscious though, and we spent quite a bit of time talking about this last week, that this word can be exhausting work. It can be demoralizing trying to, be all things to all people and invest in your colleagues, well-being and longevity of practice. So I think that your own, ability to kind of navigate your own self-care and work-life integration is very important. We've already asked about what well-being means to you at work. What does it mean at home, and how do you actually sustain yourself to continue to do this work, particularly when you're feeling challenged and you're overcommitting?
Yeah, yeah. I mean, I am the first to admit that I am not a role model in that respect, for sure. Yeah, look, I burn the candle at both ends, and I work in the weekends, and I do all the wrong things, and a lot of I do a lot of, I guess. I want to call it reframing things, I suppose, like what I was talking about with the when I had to wait for 18 months for the results of my proposal. I think that was a lot about self-talk, about putting everything in context, keeping things in context, and having to put things in perspective. I've had some really good I have one mentor in particular who's a colleague of mine in my department who just has this amazing ability to pull everything back into perspective and, bring me back into focus on what's important if I'm kind of losing my way. So he is a really good person for me to go to when I'm having a bit of a freak out or something like that. And he'll just kind of say, all this stuff that you're worrying about out here is not important. You just need to focus on kind of this side of things. And I'll be like, oh yeah. Nice. I'm a two doctor marriage, which is busy. And my husband's Māori and very, very busy in working hard in the equity space in New Zealand as well. So there's a lot of parallels between the Wellbeing crusade and the equity crusade. We often have very similar conversations, albeit on slightly different topics, but I can always see very common themes. So, I guess that helps a bit. And then I have two very busy children with, various sporting commitments and things like that. So doing the parental taxi service. But again, I mean, it's very busy, but it's not work. So it's still not, sitting in that headspace. And then my family will tell everyone that the two most important members of the family to me are our two greyhounds, retired greyhounds. So they're my therapy dogs.
Podcast.
Yeah, no worries. I'm sure I have thousands of them on my phone. But yeah, they're my therapy dogs. That sort of unconditional love when I walk in the door.
I just say that when I visited Andrea last week, her two dogs, Chips and Mocha, gave me more love than I've received in a long, long time.
Yeah.
I was licked from head to toe.
Yeah. They're pretty amazing. Good for
what would your
ideal
self-care Sunday look like then if you had to design it for yourself?
A sleep-in, starting with a sleep-in. There'd be definitely good food opportunities dotted throughout the day as well. I do like when I do ever get the opportunity to sit down with a good book. I do like that as well. Taking the dogs for a walk.
Anything you're reading, anything you'd recommend? Doesn't have to be related to what we talked about for the podcast.
Yeah, no. I'm a big Brené Brown fan, so I've read a lot of her books, and I've got the sort of halfway through the Atlas of the Heart, her latest one, which is wasn't quite what I was expecting it to be, but it's very still really useful for framing all sorts of it's amazing. I recently read Compassionomics by Stephen Treziak, and that was amazing. It's just full of all the scientific evidence behind compassion.
I haven't read it.
Yeah, it's really good actually. I've got it sitting here, so I'm looking. It says the revolutionary scientific evidence that caring makes a difference. So it's written by somebody who was skeptical about all this kind of soft stuff, and then looked into all the science behind it, and is now a complete convert that compassion makes a huge difference to yourself, to your patients, to your organisation. Obviously, Cherie's book I've referred to several times.
I know that you bought it for many other people. I usually send people who do the podcast a copy of it, but you already have it. So I'm going to get you a copy of Gillian Horton's book because I think you'll love it.
Well, thank you. I know you've referred to, I grabbed a pile. I knew you were going to ask me about this, so I went into my bookshelf and grabbed all the top ones that jumped out at me. So I've got Emotional Female there by Yumiko Kadota. I know you've read that one as well. And someone's recently put me onto The Happiness Trap by Russ Harris, which is sort of based around acceptance and commitment therapy. And that was something that it had been life-changing for this colleague that recommended it to me. So started reading that as well.
Perfect. Interestingly, Yumiko's episode is still the most popular podcast.
It's a pretty powerful story.
And, I think, thank you, because I think the conversation we have just had is powerful. I'm so appreciative of you taking time to, share your journey to date. And listen, I know this is still a work in progress. But I suppose the final question that I have for people listening, and I'm including myself in this, who are looking to continue to advocate for their colleagues in this space and maybe take on a role in, a chief wellness officer, an SMO in wellbeing, whatever you want to call it, but at that organisational level where you're actually looking to affect change and look more broadly at what we can actually do to improve clinician wellbeing, professional fulfillment, longevity of practice. What advice would you give to somebody listening who is about to embark on that journey, based on what you know so far and to date?
I really think getting your kind of crew of people around you that are like-minded and supportive is really, really important. I've made so many, I've had an interest in this for a very long time, and so slowly accumulated some like-minded people. But in the last couple of years, as I've been in this role and sort of made so many more connections, there's so much that you get from, each time you find another person, you learn so much from them, and it just gives you a bit of confidence, a bit of reassurance that you're on the right track, I suppose, when you find those like-minded people. And you do have to push for these things sometimes, so it helps to have that kind of group around you that you can go to for support. If you need to do something that feels particularly challenging, you can get a group of people together and do it together. So as you say, there's a growing group of people, some very a group of amazing people now in this area, and so definitely tap into the collective wisdom of the people that are out there. Don't do it by yourself, basically.
Yeah, and I think that's a really important pearl. And I think one of the major messages and learnings I came away from at Stanford last week is that a lot of this work is about collaboration. It's about building your coalition. It's finding, your local champions. As you say, there's a lot of great work happening in silos. How can we join the dots, and how can we build this? Because you can achieve so much more. Fantastic.
The only other thing we haven't talked about is supervision, which has been really helpful to me. I've come to realise through supervision that certainly I have a tendency, and I suspect it's common to a lot of doctors, that we feel that we need to have a qualification on a piece of paper to prove that we're worthy to be in a certain space, or that we are allowed to ask to have something or other. I started exploring doing another degree in psychology because I wanted to, I thought that would be what I needed, or I think I was thinking about heading down a kind of organisational psychology route, that kind of thing. And my supervisor said to me, you've got particularly the last 2 years, but you've got 10 years of working in this space. Just write an article about your experiences. Don't go doing a whole, he said, that'd be like having a frontal lobotomy going and doing a psychology degree.
Oh, that's quite funny, Jo. I've got my master's versus MBA information sitting in the corner of my desk today, and I probably really needed to hear that.
Yeah. So he's like, just write a paper and then you'll be published, and then you can and I say, yeah, well, it's not that easy to do that either. But it took the point, that we have to have a little bit more confidence in ourselves that we can ask these questions and advocate for these things and put in a paper to ask for something, even though we've never written a business case before. That there's no degree in wellbeing and healthcare or what have you. It's, we're forging new pathways and there is no qualification for it. So,
So back yourself and all the work and the knowledge and expertise that you have.
Yeah.
Thank you again, Jo. You know how much I have enjoyed this conversation. I know how invested you are in this work, and I know how much meaning and purpose you derive from it, but I also know how much work you do off the side of your desk. It encourages me to keep chipping away, and I really hope with like of yourself and Beth and Richards and other people out there doing these kind of roles, that there's going to be some information for people listening that is brand new today. And I really hope that in a couple of years, this is not novel. This is not trailblazing. And this is part of what we do. And we'll be able to show some measurable progress. So thank you very much, and keep going.
My pleasure.
You have been listening to the Mindful Medic podcast. If you enjoyed listening to this episode as much as I did recording it, please share it with a colleague or a friend. That's how we build coalitions. That's how we innovate, generate ideas and create change. I would also encourage you to subscribe, rate, review. I'd love to hear your feedback. There's quite a few exciting episodes coming up. I'm delighted to say that I made the opportunity to go to San Diego while I was in California and got to meet the fabulous Dr. Andrea Austin in person. We have coined the term Frienters, and it was great to meet my Frientor in person. And we have actually done a mashup podcast on recovery with Dr. Dan Dworkis from the Emergency Mind. So Andrea has a fabulous new podcast that I will link in the show notes called The Revitalizing Doctor, which is well worth a listen. So look out for that episode, which will probably drop mid-July, where we have all recorded it in 3 parts on each of the podcasts. I'm delighted to say that I'll also have some colleagues who were teaching as part of the faculty on the Stanford WellMD team joining the podcast in future too. And also Dr. Adrian Plunkett, who is the other half of the Being Better Together podcast, will be coming on next month to talk about his Learning from Excellence work. So lots of great content to come.
For example, one of my big goals was to try and coordinate the wellbeing stuff that was going on across the hospital a lot better. Like, it was really hard to find what was going on around the hospital. It was all in little bits and pieces. There was lots of work going on in silos, and to try and kind of connect all the dots across the organisation, reduce repetition, have a bit more collaboration. And of course, with COVID, that's immediately all the work that they got into, was trying to, right, who's doing what, and let's pull it all together and get it all coordinated.
And I look forward to joining you then. The MBA New South Wales ACT does wonderful work for those of our colleagues who are, at this very minute, experiencing a hard time. One way you can show you care about doctors' welfare is to go to their website, www.mbansw.org.au, and donate today. Knowing that their colleagues' care is a big part of these doctors' recovery, so please be part of the solution. All donations are tax deductible. If you can, please consider a monthly donation, as even small amounts collectively will allow them to plan their growth to support the increased demand.